The other things that people will ask me before procedure is how long is my recovery going to be? A lot of women have had kids before a tummy tuck. As I mentioned before, this is something that almost the majority of patients at least have had children leading up to them wanting to have a tummy tuck. And we say to patients that the pain level from this procedure is similar to a C-section. Not quite the same, C-section is a bit different, but the pain level and the degree of restriction afterwards is around the same. Around 2 or 3 weeks of recovery where a patient just wants to rest at home, not do too much, be out too much, not travel around or drive around or do anything too active, no exercise during those 2 to 3 weeks. And then to gradually resume activities, gradually resume exercise, and we have a whole sort of protocol that we guide patients through and what they can and can't do afterwards, which is also very important to review with your surgeon. Generally, we don't want anything that's really strenuous that's going to cause any stretching or tension on the incision from the tummy tuck, as well as any engagement of the core because we repaired those muscles and we don't want anything to be disrupted if the patient tenses those core muscles. Pain is really well controlled with pain medication, sometimes narcotics, sometimes things that are a bit not quite as strong. We give patients a lot of different options regarding the pain medication, how to manage their pain, but everybody gets through it. In surgery, I like to inject local anesthetic and we mix it with a little bit of steroid. This causes the local anesthetic that we use, which is long-acting one, to last about 12 up to 20 hours or so. And that works really well. We inject all throughout the abdomen, block certain nerves, so that when patients wake up from this procedure, there's really very little pain. It usually builds throughout the night, and then the first day, 2 or 3 days are probably the most painful. But that initial local anesthetic that I inject really helps the patient, and we found that patients do really right after surgery because of it.